They have to want treatment. Court-ordered or being pushed into treatment never works. Thank you for your comment. I'm going to respectfully disagree, at least in part. It's interesting that you say that because I know people personally who were, in your words, pushed into treatment or were court-ordered into treatment, and they got better and are in long-term recovery now. It's really a myth that you have to want to go to treatment in order for it to work. Yes, there are people who go to treatment because it's their get out of jail free card or they're trying to appease some family members. And some of those people, once they're in treatment, will hear something they needed to hear, will learn something that they needed to learn, and will get better. And some of them will go through the motions and not get out of it what they needed to, and they'll return to use. I guess my question would be, what are your options? You just want to sit around and wait on them to die and do nothing? Treatment can be a pattern interrupt and save someone's life. It may save them from an overdose and give them a chance. The substances have time to get out of their system. Their brain has time to begin to heal. And even if they don't get into long-term recovery on the first go-around, it extended their life and it planted a seed for recovery later down the road. As far as this being pushed into treatment thing goes, I think you kind of got the ideas mixed up a little bit here. When families set boundaries, those boundaries are designed to protect the people on the inside, not to control the addict. And families should stop enabling behaviors because it's harmful for them and for the addict. Enabling keeps the person battling addiction stuck in their addiction. It prevents them from maturing. When a family sets healthy boundaries and stops enabling, oftentimes the addict will choose to go to treatment because they cannot sustain independent adult life without the enabling behaviors of their family. Sometimes when families have been so wishy-washy in the past, when it comes to maintaining their boundaries, they have to employ the help of a professional to communicate those boundaries effectively. And that is in part what an intervention is for. Clear communication of new boundaries.